Board. I'd now like to yield to the gentleman from Indiana, our new member here, Dr. Larry Bucshon, who is a cardiovascular surgeon, brings a great expertise in cardiovascular surgery. Welcome to the floor tonight, Dr. Bucshon.
Well, thank you, Dr. Rowe, for yielding. I was a cardiothoracic surgeon just recently, last year, prior to coming to Congress. I help patients and their families make informed decisions regarding the care they need or the care of their loved ones, what they needed. I provided a professional opinion based on the facts, and sometimes had to convey information and news to patients and their families that they didn't want to hear. Mr. Speaker, I came here to tell the American people the truth that sometimes can be difficult to hear. But the American people deserve the truth about what's happening with health care in this country. The majority of my patients were Medicare patients. We know that Medicare is one of the main drivers of our long-term systemic debt. I want to reiterate that on May 13th, the Medicare Board of Trustees released their annual report on the program's financial status. In it, the Medicare trustees stated that the Hospital Insurance Trust Fund will become insolvent in 2024. That's within 13 years, Mr. Speaker. 5 years sooner than last year was predicted. And from a physician standpoint, according to the American Medical Association, 1 in 3 primary care doctors is currently limiting Medicare patients in their practice, and 1 in 8 physicians is forced to refuse Medicare patients altogether due to the cuts already that have been made in the Medicare program. And with the Medicare population estimated to double by 2030 to approximately 70 million Americans, imagine the access problems we're going to have then. Today, the average couple that turns 65 has paid in over $100,000 to the Medicare program, but is receiving over $300,000 in benefits. Mr. Speaker, this is not a sustainable model. Without significant reforms, beneficiaries in the future are going to be at risk for limited access to quality care they deserve and they count on, and ultimately face rationing of care, waiting lists, and dramatic cuts to current seniors based only on the cost, not based on what Dr. Rowe has said, the quality of care or what type of care they need, but based on the money alone. Anyone promoting the status quo is dooming Medicare to failure, and soon. It's coming up in 2024. Our plan doesn't affect anyone, any American over age 55. They've counted on these benefits. But what it does, it preserves the program for future Americans. Again, the status quo is dooming Medicare to failure, and soon. Congressional Democrats and the current administration have offered no plan to date, except the Independent Payment Advisory Board that Dr. Rowe and others have been talking about in the Obamacare bill. 15 unelected Washington, D.C. bureaucrats making decisions about Medicare, making decisions about the future of health care for our seniors. IPAB was thought to be maybe the silver bullet, if you listen to them tell the story, to control costs. But what IPAB really will do is will recommend cuts be made to the program, not savings, cuts we're talking about here. CMS will then make those recommendations to Congress unless we get a 2/3 vote. They go in play. They start to happen. We have given up, as Dr. Rowe said, our congressional authority to do something about the future of health care for our citizens. This is a misguided approach that will, again, empower this group of unaccountable bureaucrats to determine the type of health care you may receive based on your age and your health. Health care decisions are best made when left up to the patient and their doctor. You and your doctor and your family know what's best for you, not the government. And I want to finish by saying, for me, personally, Mr. Speaker, this is about the future of health care for the American people. I fear for what the future may hold. Access problems, waiting lists, rationing of care. Look at other countries that have socialized medicine. All of these things are occurring. This may be based on your age, based on your health. We don't know what they're going to be based on in the future. It could be based on other factors. Do we really want this type of health care for the American citizens? I would answer no on behalf of my patients and behalf of all Americans, and especially in the case of IPAB on behalf of our American seniors. And with that, I yield back Dr. Rowe.
Well, Dr. Bucshon, let me throw this question at you a little bit. When you are seeing patients in your practice, and basically those healthcare decisions are made between you and them, when you look at their relevant clinical data and their symptoms, and you can see that there's a lesion, maybe a heart surgery that you can do to help them, and it's based on what their needs are. And I have never understood, since I've been in this Congress, why healthcare has ever been a partisan issue. Have you ever seen a Republican or a Democratic heart attack in your life?
Never.
No. And
They're Americans.
I've never operated on a Republican or Democratic cancer in my life, pelvic cancer. Why in the world? And so this is one where there is bipartisan support, because both sides of the aisle understand this is a very bad idea to get on this slippery slope where you allow Washington bureaucrats, and they can be called experts if they want to be, but they're going to be making clinical decisions for people they never have placed an eye on or a stethoscope on their chest. And I, for one, am going to go down swinging on this, because I believe this affects all the people in this country in a very, or potentially in a very negative way, including the president, because he will be under this same plan. And unfortunately, many people will probably try to opt out. We're already seeing all the opts out for the private health insurance plans, but I, as a 65-year-old, can't opt out. I'm in. I'm going to be part of this. And I know what my patients have wanted, and I just wondered if you've seen the same or feel the same way I do about that. And I yield to the gentleman.
I feel exactly the same way, Dr. Rowe. For me, again, I've never seen a Democrat or Republican patient. I see a patient. In fact, in my practice as a heart surgeon, frequently I didn't even know what type of health care coverage that patients have. For a doctor like you or me, for any healthcare professional, what matters is what's the right type of health care to provide for that patient, regardless of ability to pay. And what we're looking at here is the potential where these bureaucrats may tell you, Dr. Rowe, that you cannot treat this patient based on their decision about whether or not it's affordable for the American people. They're going to make decisions based on money, not based on what needs to be done. And with that, I yield back.
The gentleman yield. What I believe will happen in that situation is that the federal government will have overpromised, and what we as physicians will do is provide that care and shift that cost somewhere else until there's nowhere else to shift it. Because I know how, if I see a patient that needs care and they are 75 years old, let's say, and they have needed surgery and I can improve the quality of their life with that, we're going to do it some kind of way. And you know you've done it. We just figure out later how to pay for it. That's not the way to do this.